My name is Sigurður Kristinsson. I'm a hematologist at the University of Iceland, and I am the PI for the iStopMM study. My talk was termed, What have we learned about the iStopMM study? And basically I covered what we have published in recent years. So in short, the iStopMM study stands for Iceland Screens, Treats or Prevents Multiple Myeloma. And back in 2016, we invited all Icelanders 40 years and older to join the screening study, and 54% of the Icelandic population gave informed consent. That it's more than 80,000 people. Since then, we have screened more than 75,000 samples and identified approximately 5% of the Icelandic individuals have MGUS. So then these individuals enter a randomized clinical trial with different kinds of follow-up. And the overall aim of the study is to really understand if screening for MGUS and myeloma is beneficial in terms of overall survival, progression, and so on. So what we have presented here at the meeting is, firstly, I think it's important, the prevalence of smoldering myeloma, which was really not known before because you have to do a bone marrow biopsy or an aspiration to do that. So we identified that 0.5% of 40 years and older have smoldering myeloma, and this certainly has some implications when it comes to treating and follow-up of smoldering myeloma, which is a very hot and interesting topic at the moment. Also, we have identified differences when it comes to progression. So if we actively screen and look for them and evaluate and work up and follow up these individuals, we will find more advanced disease. So screening compared to no screening, we have identified more smoldering myeloma, more Waldenström and smoldering Waldenström, and so on. There's really a clear and statistically difference between these two entities. Also, we can see that we really have changed the clinical phase of myeloma. And by that, I mean that if we are diagnosed with myeloma through screening, we detect the disease 1 year earlier on average, and we have less CRAB features and less acute presentations compared to those individuals that just turn up at the hospital with full-blown malignancy. Also, we have identified and developed a model, so you can use that to help you decide if you want to go ahead and do a bone marrow biopsy or aspiration in individual with MGUS. So basically it gives you an idea of what's the probability of finding smoldering myeloma or more than 10% plasma cells. Then you can use that in the clinic to help decide if you should go ahead and do a biopsy or not. So these, I think, summarizes the main findings of the iStopMM study so far, and obviously we will continue to do more research in the future.